alaikum. This is Dr. Tazeen from StudyMedic, and I welcome you all with this OMR series for all those aspirants who are preparing for their MRCPI OSCE, the great initiative by StudyMedic, in which we are covering the important OSCE stations for you. So if you have not subscribed the YouTube channel of StudyMedic, please subscribe now and then click on the bell icon so that whenever the new series are uploaded, you can get notified. So today we have an important OSCE station for you. We shall be discussing with you, and I hope this will be helpful. So these are the instructions for you, for the candidate that patient has presented to you, Miss Sufi, who is 36 weeks of gestation, and she has presented as she was unable to find the fetal movements, and now the midwife has told that there is intrauterine fetal demise. So you can go through the instructions and then we will start the discussion.
Okay, hi, Tazeen. Probably we can start off so that they would learn how to do this task very well. So probably we can keep the timer
So
and
guys,
then we
with
can start.
me is Dr. Soumya, and everyone knows that about Dr. Soumya, so no intro is needed. So she will be helping us that how we have to accomplish this task. Thank you so much, Dr. Soumya, for being here.
My pleasure, my pleasure. Thank you so much for the kind intro.
So, hi, I'm Dr. Tazeen, one of the registrar in clinic today. May I confirm your name and age, please?
Hi, I'm Sophia and I'm 32-year-old.
Sophie, can you please tell me that what brought you to the clinic today?
I don't know, like I'm really upset and I'm very in a state of shock because the scan, the sonologist who just did the scan said that my baby's no more. He can't see the baby's heartbeat. I'm really worried. Is this true? So that's the reason I'm here to talk to you.
I'm so sorry, Sophie, to hear all about this, and I know this might be a difficult time for you. So I can see that you are alone in the clinic. Would you like to call your partner with this discussion, or you are okay?
No, because he's not here. He has gone out for a business meeting, and I'm really worried. I am really clueless, Doc, how to go about because is it true that my baby is no more?
Okay. Sophie, is that okay that if I ask you a few questions and then we go further with the discussion?
Yeah, okay.
Okay, can you please tell me more about your pregnancy? That have you been pregnant earlier?
The thing is, like, definitely, this pregnancy was something much awaited because I was quite busy with my own studies, and so, but I conceived on my own, and like everything was fine. I was booked with my midwife, but yes, I was quite. I work in a very hectic job. From last 3 days, I couldn't actually feel Tim's movements much, but I was thinking this is purely due to probably this is due to my work schedule and things like that. And I tried contacting my midwife, but obviously she had asked me to come over, but I went only yesterday when she couldn't feel the Tim's heartbeat, and she said to me to come today for go to the hospital. And I know that something was not right because from yesterday night, I couldn't feel any of the movements at all. And when they did the scan, they said that Tim is no more. So probably it's all my mistake. I should have come early. I should have done things. I don't know. I think I feel terrible.
I'm so sorry, Sophie, that you are going through a tough time. So, can you please tell me that when was the first day of your last menstrual period?
To be very honest, I do not remember the date at this point, but I think I'm into my 36 weeks.
Okay. So, is there any medical concern for which you are following up with your GP?
No, I have been very regular with my exercises. I've been fit and fine. I never had any issues.
And I'm sorry to ask, do you smoke?
Actually, yes, because this is also one of the guilt which I feel because my midwife had told me several times, but I couldn't stop smoking. And I do smoke 20 cigarettes per day. Doc, do you think this is because of this I have lost him?
Okay, no, Sophie, we can look into various other reasons as well, and then we can try to find out that what was actually the reason. First, we have to go through the other things, and then I can confirm you. But it's good that you, if you are feeling to quit smoking, then we can connect you to support groups, and they can help you in quitting smoking. Is there any
Okay.
health concerns for in your family which is that they are that is important?
Not that I'm aware of.
Do you drink alcohol?
No, I don't drink. I used to drink very occasionally, but I've stopped it when I became pregnant.
Do you have any known allergies, Sophie?
No.
Okay. So, can you please tell me that what are the concerns now at the moment that you are worried for?
Obviously, I'm not sure what to do. And should I get a second scan done? I don't know because I cannot believe that we have lost him. And I really want to know, did I do anything wrong? Why this happened to Tim?
Okay. Sophie, actually, what we will do at the moment is that I will go through your antenatal records and I will check your blood pressure as well, and I will do your tummy examination and I will try to check out your baby hearts. If they are not audible, then we can get your ultrasonography done, and that will be the reconfirmation test. Will that be okay for you?
Yeah, that should be okay.
And once the we confirm your baby's heart, if they are not audible, then Sufi, I am sorry to say that then we can confirm that the baby is no more alive in the womb.
The thing is, like, actually, I know that for sure that I can't feel Tim anymore, but I'm really worried why this happened because everything was low risk and it's terrible because we have been looking for Tim. And what would I tell my husband? I'm really worried.
Sophie, I can understand that you are worried for the baby, but in most of the cases, actually, unfortunately, we are unable to find out the cause, that what actually was the cause for the baby. But I can assure you that in 60% of the cases, the cause is unable to be detected. But there are certain reasons for this, that the baby might have got infection in the womb. Maybe that can be the reason. Okay, at times the blood pressure and blood sugar levels, they might be uncontrolled, so that can be a reason for that the baby is no more in the womb. So we can try to find out the cause. For that reason, we have to check your blood sugar levels, as well as we have to check your blood pressure. We will send your urine for testing as well, and once we find out the cause, then we can discuss further with you.
Yeah. Okay. So, is there any test for the Tim also to be done? I'm not sure.
Yes, Sufi, a few tests we will be conducting on you, as well as we have to do the testing of the baby after birth as well. For that reason, first we have to go through the birth of the baby. Once the baby is born, then testing can be done on the baby as well as on the afterbirth, so that we can find out the cause of the that why the baby is not there.
Okay. So, I don't know, like, it's very difficult to think, but should I go ahead for a cesarean section? Because I don't know, it would be very painful for me to go through the process. I feel, I don't know what are my options for delivery.
No, Sophie, this is not the reason that you have to go for cesarean section. There are two ways that we can deliver this baby. The first thing is that you can wait naturally. You can wait, and for that reason, in most of the patients, they can start the labor pains naturally. But for that reason, you have to. We shall be checking you twice weekly you have to keep your checks so that you are feeling well and there are no concerns. The other thing is that we can start the labor itself by giving you the medications. We will give you medication, and the option is that you can take medicine and you can also go home. Once you start the labor pains, then you can come back to us, or you feel unwell, or you are not feeling well, or the pain is there, or you are unable to tolerate pain, then you can come back to us. And Sufi, there are various ways that we can control your pain, and we can give you the medications so that you are not going through a lot of pain. Are you with me, Sophie?
Yeah.
Okay. So what we can do is that during this whole process, once the baby is born, then we can take the blood sample of the baby, and then we can send it for the testing as well. But if you are waiting naturally for the baby, then there are certain concerns, Sophie, that actually the general appearance of the baby, as it has been long time that uh, he has died in the womb, so the general appearance can change. And then the tests which we are performing on the baby to find out the cause of his death, that they can be less conclusive as compared to that we do it as early as possible. Are you with me?
Yeah, probably I don't know, like too many things running in my head. So, like what I would like to do is definitely I would want to go for one more scan for reconfirming, and probably I would discuss with my partner and then come back like tomorrow for the probably the to take it next. But I definitely want to avoid this in my, if I have a reason why this happened, I would definitely want to know that and avoid this in my future pregnancy for sure. And yeah, that's the concern which I've got now. So how, like, about, definitely I would need time to think about it.
That's perfectly all right, Sufi. You can go home, you can take your time, you can discuss with your partner, and then you can come back. If any time you feel unwell, you feel that you are not well, or there is any concern, you can call to your midwife, and we are here to support you and we are here to help you.
Okay. And also, like, I wanted to meet any of the Bremen counselor because it's becoming a little difficult for me to take it up. So, if you could help me with that.
Yes, Sophie, I will connect you with the support groups so that they can help you and they can support you. Also, one member of the team, they will also discuss with you about the funeral of the baby after birth, and we will definitely respect your beliefs and we will support you in that as well. You can also, after birth, you can touch your baby, you can take the photographs or hand or footprints. If you want to take it with home, that would definitely be your choice and we will support you.
Okay, that should be fine.
Okay, Sophie, I'm giving you a few information leaflets with you so that you can read it. I am connecting you to the support group, and I am providing you the contact details of the maternity care so that if you are feeling any concern, you can connect us and we can help you. Will that be all right?
Yeah, that should be fine. Thank you, doctor. So, I think I would be able to get a scan in, and then probably I need to speak to my partner as well. So, definitely I shall do that. Thank you.
Yes, definitely. Sophie, I will book a scan for you and we are here to help you. Okay?
Oh, thank you. Yeah.
Thank you so much. Thank you. Take care.
Yeah, yes. Tazeen, okay, I'll let you go first on the, okay, reflection of your task. Because it's always, whether you pass the exam, whether you're giving the exam, we are always in a very hot seat when we are doing the task. So what is your reflection of the task?
Actually, this is about the breaking the bad news. So when the patient is distressed and you are also an exam candidate, you also get, a bit worried and things like that. And that is the same situation in exam as well. When your patient is distressed, you being as an exam candidate, you are also stressed. So at times there are chances that you are forgetting few things and you are, forgetting
Yeah.
few concerns of the patient. But the most important thing I would say that the empathetic approach, it should be there, so that we can
Yeah.
support the patient more, and we can provide her all the important information which is needed for the patient.
Yes. So I would say, like from the examiner point of view, your approach was really nice. Like you were empathetic. Your pace and tone of the speech was really nice. You let the role players speak. Generally, what happens? People do not actually check the understanding twice or thrice about me, and like you went on well about confirming and things like that. Few things, because you already know she has an IFT. So if you ask, like it's beginning sentences, you can make it a little more beautiful, telling that I'm aware of why are you here and I'm sorry to meet you at such circumstances. So you're setting the environment well. Other than that, I think you went on well. You asked about the allergies and a couple of things like the family history. Those things you asked, the history was quite quick, and probably the only thing which I said is thought was like, instead of telling 50%, you could just say that half of the times we don't know why this happens, but we would do all the tests to figure out. And probably a bit about lactation suppression after the delivery. So because if you're talking about the delivery, then obviously you have to talk about this one. And I wouldn't expect you to tell me too many things, because the time I know it is 10 minutes. So probably a passing thing about, if you wait, we will make sure that your clotting tests are performed. So, you will tick the examiner boxes. Apart from that, I think you gave the informations and everything. So these stations are the killers one, because the communication, if you keep it right, because see here, one thing was probably the smoking part. You could have just said that, you said to me, and I was like, partially probably was okay. But if you could say that, do not blame yourself. Okay. So that is a word which I was looking for, because I was blaming myself, right? So if you put across the thing and reinstate the fact, don't worry, this is not your fault. Okay. Don't blame yourself. So this need not be the reason. Yes, this could have added the risk, but this is not the only reason. So let's figure out what to be done, because you can't say this won't cause, this could have caused. At the same time, we know that all smokers will not have, right? So yeah, I think rest of the things you tick the box. This is definitely a clear stage pass station, but too few things to make it perfect, because when we practice perfect, then exam would be cakewalk. Well done, good job. Yes.
Thank you so much. Thank you so much, Dr. Soumya. Thank you so much. So here are few things which should be there when we are doing the station. That good intro should be there, empathetic and supportive approach in such cases. Then to explain all the causes and to discuss the modes of birth, what tests we need to perform on the baby as well as for the mother. Then post-delivery support as well as counseling about the future pregnancies.
Yes, Tazeen, thank you so much for all the hard work. Thank you. So
thank you so
yes,
much.
they will be definitely learning in this OMR series, because this week is your week. Thank you. Thank you so much.
Thank you so much. Take care.